So you're interested in larger or fuller lips. There's really three ways to augment your lips. One option is filler injection, such as Restylane. This comes off the shelf in a syringe, and we inject it into the deficient areas of your lips, or where we want to add volume to your lips. In the lips, I find that hyaluronic acid fillers last about 6 to 9 months. There's a lot of motion around our lips, so I don't think it's safe to say that fillers last a year or more in that area. But that's one option. So it's easy, it's off the shelf. If you don't like it, it's easy to dissolve. If you need more, you can always get another syringe of filler. Each syringe of filler is around $600 on average. So it's very customizable and it's not permanent. So if you're interested in lip augmentation and you've never had anything done, I think fillers would be the easiest, safest place to start. If you get filler injections into your lips every 6 months, 9 months, you've been doing it for years, you're sick of wasting your money on filler all the time, you might want to consider permalip implants. So permalip implants are these little silicone implants. They come in multiple lengths in 3 different thicknesses. They're silicone, so basically it's a very simple procedure to do. It's like going to the dentist, but more fun because your lips look bigger when you're done. And I'll numb up your lips, so we'll put topical cream on first, wipe that off. I'll inject lidocaine in your lips so you're numb, and then I'll make a little incision on each side, tiny. I mean, I don't even use a knife to make this incision, I use a needle. And then I will pass this special forceps through. It's called a tendon passer, but basically that goes one way to make a tunnel. I grab the implant and slide it back the other way. So it's really easy to put these in. It takes about 15 minutes or less to put both the upper and lower lip implants in place. And then before that, you'd be numbing up for about 15 minutes. So the whole thing takes less than an hour to have lip implants put in place. You will have some swelling afterwards, less swelling than fat injections, but more swelling than filler. But they are a great way to permanently augment or increase the size of your lips. What I love about the silicone lip implants is not only how easy they are, but it's very predictable. Meaning if we put in the 4mm diameter lip implant, we know that that is exactly the augmentation or change that we are going to get. Now compared with fat injections, it's more predictable. So with fat injections, the beauty of fat injections is it's your own tissue. The downside is we don't know how much of that fat is going to live or stay long term. In general, it's probably 50 to 70% in the lips, but we just don't know, so there is much more variability. On top of that, the lips after fat injection get monstrously swollen. After I inject fat in the lips, they get really, really swollen for about a week, and then they go down over the next week or two after that. So that is the downside of fat injections, is there's lots of swelling and it's a little less predictable. Now, let's say you're having fat injected to your face for other reasons. You're having a full facial rejuvenation, facelift, neck lift, lasering, eyelids, brow lift, fat injections, the whole 9. By all means, we would use fat to increase the size of your lips at that time. Since you're going to be recovering from all of that anyways, and we already have the fat, it makes sense to inject fat in your lips. And if you're happy with how they look after that, great. You don't need anything else done. If you're unhappy with your lips after that and you still want more volume, and we've already injected fat once, I would say, you know what, you should consider the lip implants because it's a much more predictable and permanent solution to augmenting your lips. So that's the summary of it. There's filler, there's lip implants, and there's fat. The pros of the filler are that it's easy and predictable. It comes right off the shelf. It's fast to do. You can always get more, and the filler can always be dissolved. The downsides to filler is that they don't last forever. The lip implants are great because they are a permanent implant. I mean, it's easy to take them out if you don't like them, but it's a permanent solution to augment your lips. It's an easy procedure that's fairly painless. The recovery really isn't much. The recovery is pretty simple. It's just a little bit of swelling. The downside is it's a little bit more expensive. It's around $2,500 to have upper and lower lip implants placed, whereas each syringe of filler is $600. And then when it comes to fat grafting, the recovery is much longer. The predictability is much less clear. We don't exactly know how much fat's going to live, and fat grafting the lips doesn't cost anything extra if you're having fat injected somewhere else. So in that way, it's very cost effective. Hope that makes sense about the different options you have to increase the size of your lips. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.